Washingtonians. Seeing the numbers like 6.5 million vaccines have been administered in Washington state makes me proud of the role that we've had in this effort, and I hope you are too. So, before we get started, I just wanted to introduce myself. My name is Jennifer Hansen, and a bit about me is that I've been, for the past 30 years, I've been a Washington state government employee. 19 of these years have been with the Department of Health. And then for the last 6 months, I've been in my current role as the IIS COVID Provider Outreach Coordinator on the PrepMod team. Along with my teammates, we have learned so much about PrepMod and its contribution as a scheduling tool that is used for COVID vaccination clinics in Washington state's efforts in getting shots into arms. Thank you for doing your part to help the state move forward in this pandemic. Before I have my co-presenter introduce herself, I just wanted to mention April McClelland as our moderator of the chat and the assistant to help us move through the PowerPoint slides. Marisa?
All right, hello everyone. My name is Marisa and I am also a provider outreach coordinator as well as the department's IIS trainer. I have been in this role with the Department of Health for about 6 months, and I have about a year and a half of other experience within the government. I've learned a ton being part of this team, and it's been awesome to be part of the COVID response. And I'm really excited to share some of the things that we have learned at the IIS and PrepMod so far with all of you today. All right, and can we move slides? Thank you.
Why we're providing this training today is our commitment to providing relevant training to support our PrepMod users in conducting successful COVID-19 vaccination clinics. And that's the main goal of bringing you the training today. We would like to continue to provide training and share our knowledge on topics that are important to cover as a good use of our time and effort, and to understand and give solutions to everyday challenges in working with PrepMod. There's so much to learn and understand as functionality becomes available in PrepMod and how it can help you in the future for your clinic planning as we move forward in vaccinating the eligible 12 to 15-year-old population. In coming up with the structure of this meeting, Marisa and I will be covering our topics through the PowerPoint slides and also demonstrating within the IIS and PrepMod. We will also be answering questions periodically, but for the sake of getting through our presentation, we may need to move your question to the question and answer period towards the end. If your question requires more of an individual one-on-one type meeting, please give us your email address in the chat and we can contact you and discuss it further. The PrepMod team is available 7 days a week through monitoring the PrepMod inbox, and we'll share our emails and resource links at the end of the presentation. So without further ado, let's get started. Next slide, please.
All right, so to just jump in here to before the clinic with the IIS, I did want to just let everyone know if anyone in here does not have access or has inquired about PrepMod yet, it is currently only used for COVID-19 vaccines, and you do need to be COVID approved in order to administer those. So I did just want to make sure that everyone was aware of that before we got started. But again, there are some things in the IIS that need to be in place as well before using PrepMod for a clinic. So I'll be going over those things as well as the PrepMod test site. All right, next slide, please. So for the PrepMod test site, once you have inquired and begin the onboarding process with the PrepMod team, you will be given access to a test site account, which is exactly like the production site, The only difference is it does not house real data and it's not intended for real data. So that's a big factor in there. We're only using test data in the test site, and you will know that you're in the test site by this red banner. We did attach a screenshot here. So it will say this is not a test site, do not enter real data or sensitive information. So once you do get access to a production site, it's just important to make sure that you are aware of which one you're in. Kind of on the flip side of that, we don't want to be using test data in the production site as well. So just ensuring that we're in the one that we intend to be in. The test site is used to test functionality and see if PrepMod is a good fit for your organization. And if you are able to, it can also be used to perform trial runs for clinic days. If you have the time to prepare in that way, that's an awesome thing to be able to do. So it is important as well to add staff members so that they can become comfortable with the PrepMod site before going into a live clinic day. All right, next slide, please. So for the IIS portion, before running a PrepMod clinic, there are some things to have ready in the IIS and be aware of. I did attach a workflow at the top, so this will kind of bring us all the way through ordering and then administering vaccine. So the first step would be to order the COVID inventory in the IIS. The second step would be to receive shipped or transferred inventory. The third would be then to add to the inventory to the PrepMod clinic and then to administer the vaccine as our last step. So I will mainly be going over the second step here today, so receiving shipped or transferred inventory. I will be going over orders and transfers and how to receive those properly. I will also be briefly showing a new feature in the IIS called advertisements. They do tie back to transfers, so they're related in that way. And then I will be showing lot numbers and the reconciliation screen and how those kind of tie into PrepMod, how we can make sure that our lot numbers and our inventory is all good to go before running a PrepMod clinic. And I do have guides that provide step-by-step directions. All of them are linked right here. So we will make sure that this PowerPoint goes out to everyone so you can click on these links and get those step-by-step directions if you need them. Next slide, please. All right, so I am going to actually jump into the IIS testing environment over here. And this is a testing environment, so there's no real data in here. The reason that we want to make sure that we have everything good to go in the IIS environment and we receive these orders and transfers before going into PrepMod is that if a lot number is used before it is received. So we set up our PrepMod clinic, we started administering, but we haven't received everything, all the inventory into PrepMod. It can cause some data transfer issues when we submit the data in PrepMod. So it is very important to have all of the steps that I'm about to show you done before entering our lot numbers into PrepMod. So the first thing we'll do is go down to orders and transfers and then create view orders. And this, again, I will be showing how to just receive these really quick. So we'll want to select our order. We'll select the quantity that we want. And on your end of things, so on a provider side, these sections right here will all be filled out. This just isn't a real order because I'm in the testing environment, so these aren't filled out right now. Ideally, in a real environment, these would be, but I did just want to show that these are the things that you will want to review and ensure are correct before receiving the order. So the big one is the expiration date. On our end, we've seen this dummy date pop up quite a lot, and so I did want to point this out. The 12/31/2069 date, this is not the real expiration date of the COVID-19 vaccines. So you want to be sure to check either the vial of Pfizer or online for Moderna and J&J to make sure that you enter this correct expiration date. If you don't do it in here and you receive the order, that's okay. I will be showing how to edit a lot number later on, and I'll show that in just a minute. So we do want to leave this reason for rejecting completely alone. If we select anything in this drop-down menu, it will actually cancel our order. That can be really easy to forget when you're just kind of clicking through and looking through all this. So that is something to keep in mind. So once we click receive, it will disappear off of our inbound orders, and it will appear on the reconciliation screen, which I will show in just a moment. Inbound transfers are pretty much the same. You'll put your receipt quantity, and all of this information should already be filled in, and then we would just click receive here. So those two have disappeared out of here and should appear on the reconciliation screen as active lot numbers. And then I did want to show the vaccine advertisement. This is, again, a new feature in the IIS. It is a form of transferring vaccines, so it is just another way to gain inventory. There are kind of two sides to this. If I am a provider looking for more vaccine, I would want to make sure that I stay in this view all vaccine advertisements. So we have a list here of providers who have posted vaccines that maybe they can't use before they expire or just can't use in general for some reason. So they will post them here. It's important to remember that when you contact them, they need to initiate a proper transfer in the IIS. So they would fill out the information to transfer to you, and then you would want to receive the transfer like I just showed. If you are interested in advertising, so you actually have extra, you would just go in here. You basically just fill out your contact information, phone number, email, and then how much you would like to advertise. So I did just want to show that really quickly. Once you have received all orders and transfers, we're going to head to the reconciliation screen. And this is where all of your active lot numbers will be housed. So the one that I just accepted a moment ago, just received, is right up here. So we have that dummy date here that I did not change. So I'll be showing how to change that in a moment. A few things to keep in mind on the reconciliation screen. Again, these are all active lot numbers. There are no inactive lots on here. So you are free to choose one of these for the PrepMod site as long as everything else is aligning properly. The first thing to look out for, of course, it's a lot number, and ensuring that if you would like to choose this lot number to put into PrepMod, it's being entered exactly how it looks on the screen. The next item to be careful about would be the expiration date. And then the third would be the quantity on hand, which is how much we have according to the IIS. So the first thing to be aware of with this one, of course, it's bright red. It's bright red because this is expired, and there is a legend at the bottom of this page that will tell us that. So it expired about 17 days ago. We would not be able to use this lot in that case, of course. The other thing to be aware of would be the quantity on hand. So if you are running a mass vaccination site, even if this was not expired, this probably wouldn't be a good lot to choose just because there's not enough. So we would want to hop down here, maybe choose this one or this one. And you can use multiple lots in a PrepMod clinic. So we could choose a couple of these different ones if there wasn't quite enough of one. All right, so if we wanted to, let's say we need to change this dummy date right here. So I am going to go over to the search and add under lot numbers, and this is how we can search for a lot number and edit it. There are a couple ways to look up lot numbers, ideally like I just did. If you know a lot number, you can type it in or copy and paste it in. If you are looking for a lot number just of Moderna, but you're not sure, you want to see all of them, active or inactive, you can actually just search by any Moderna. So it will come up with all of those. I just want to search for this one though, so I'm going to put that lot number in, and then to select it, you will just click on the name. And this takes us to the lot number maintenance or detail screen. So lots of different details, basically all of the actions on the lot numbers. So doses used, wasted, returned, or disposed. This number right here, that you will see on the reconciliation screen. That will always remain the same. That's basically how much has been put into the IAS. So even if these numbers up here change, that will only impact. So if we wanted to change this false date right here, we're going to go over to edit. And then we will want to put in the correct date. So let's say it's, next month. So maybe the 12th. And then we would just click save. It will turn bright yellow because this is still within 30 days. So our lot is expiring soon, sooner than 30 days. So that's why this highlighted yellow. And that is how we would edit that lot number right there. All right, and April, I'm going to turn the screen back to you for the PowerPoint. Okay, and on the next few slides, I did just kind of put a summary of what I talked about with some screenshots for future reference. I did, as I said before, post guides for all of these on the other screen as well. So, but I did just want to have summaries of the steps that we went over. So this would be the orders and transfers, just making sure we're selecting the correct order and then looking over all of the information like the lot number and expiration date. Next slide, please. And then in advertisements for providers that have extra vaccine or a vaccine that they can't use or providers looking for vaccine, we have this slide. So we're looking at over on the left-hand side, the vaccine advertisements, and then making sure that we're selecting if we want to just view them or if we want to advertise. Next slide, please. On the reconciliation screen, we have those three things that you're going to want to be aware of. So the lot numbers, expiration dates, and then the quantity on hand, and making sure that all of those go into PrepMod the exact same way. And then how to search and edit our lot numbers. So if we need to change an expiration date, then this is how we would do that. All right, next slide, please. All right, and April, are there any questions in the chat?
No, none at this time. But if anyone wants to drop a question in the chat, I can try to reply as we go. Otherwise, we can discuss them at the end of the presentation.
Great, thank you.
Okay. Okay, so I will be sharing some things to keep in mind in choosing clinic type. Next slide, please. In choosing a clinic type, in the past, there's only been two types of clinics, either public and private, and they have just added two new ones, which is private open and invitation only. A public clinic is open to all, and registration is accessible through our DOH vaccine finder or through the provider's communication plan. The second is a private clinic and has registration and clinic information that is accessible via a general link that you can email to a specific group of patients. This general registration link can be used by anyone that has access to it. A private open clinic has registration and clinic information that is accessible through a specific link that is emailed to patients, but clinics don't have to have a set time and date. However, You must close the clinic within 24 hours of the first recorded vaccination. An invitation-only clinic has registration and clinic information that is accessible through a specific link that is unique to the emailed patient. This is a personal one-time use link that expires after use or after the registration deadline. As a note, you can change clinic types to serve your clinic planning purposes. For example, if you wanted to start with an invitation-only clinic and then change it to a public clinic, that is doable. Next slide. A great feature of the invitation-only clinic is the capability of uploading a registration list. In order to do this, they have a sample file format to follow, and it must be saved in a CSV UTF-8 format, which I'll demonstrate in just a moment after I take over the screen. Okay. So first thing you want to do in creating your invitation-only clinic, and say you wanted to create a second dose clinic and use the registration list from a first dose clinic, you want to upload the registration list from the first dose clinic. So I would go find your clinic. I have a lot of test data for today. And then you would click on the registration list. Once you are here, you want to download the registration list, and it will be exported in an Excel spreadsheet. Just a moment. Okay, it's taking longer. Hmm. Okay, let's try this again. I'm so sorry, you guys. This was a glitch that I didn't foresee. So I can't really demonstrate this if it doesn't do what it's supposed to. So I'm not sure at this moment how to do this. So let's go back. Search my clinic. Want the registration list. I want to download the registration list. Okay. This is the glitch that's happening today. I am so apologetic for this happening at this moment because it's really a cool feature and I wanted to share that with you. Okay, so honestly, I can do a step by step by just saying what you do. And then if I'm able to at least get the Excel spreadsheet up, then at that point, then we can move forward. Okay, I know. I do have the spreadsheet available to download. So, okay. So I'm just going to go through the steps of doing it, and then I'll be able to show you at some point the how to upload it. So basically, when you are clicking on that, an Excel spreadsheet shows up and it has all of the information from your registration list. And if you're wanting to pick and choose from that registration list your second dose folks that you want to invite, then you would copy and paste um, their name, their first name, their last name, their email address, and their cell phone number, if that's listed. Let me see if I can find what it would look like. This is a very interesting format. Okay, so basically what happens is when you are in wanting to download the registration list, it will come up with this sort of format, and this is the sample file that you will need to save your information into. It's like first name, last name, email address, and then phone number. Okay. Let me just see if this will work. Okay. Okay, so once you get that list put together in the format that they have as a sample, then you'll go to your the clinic that you're created for your second dose, and then click on registration list, and then upload an invite, and then you'll choose the file. So this is what the screen would have looked like if I would have been able to open up that the spreadsheet for the Excel file. What happens is you get the sample file here, you open it, and this is exactly what they want you to use, the format that they want you to use. So I am just kind of winging it here because my PowerPoint presentation is a little bit changed. So what you would do is like from the very first list that you had, and it's the registration list from the first clinic, and you wanted to invite those to the second dose clinic, you would add their names here, their first name, their last name, their email address, and their phone number. And then once that's done, you would save the file. And you'll also need to choose an expiration date for your registration of those folks that are going to be registering, that you're sending this list to. I would give it a week, maybe, and then that will be a really important thing to note, because it will be an important step if you want to change from invitation only to a public clinic after the registration deadline. So this is what that is important for. And then once you click on invite patients, you can click on, I can hear my phone as it has just dinged me to let me know that I received the invitation via text message. But you can view the folks that you did invite to the second dose clinic. And then it would be from there that they would get the link and register themselves. Okay. Let's see. And then for the purposes of testing, since I did use my email address and my cell phone number. And if you want to see what the process is like too, then you can go ahead and do the same thing. And once you invite the clinics or the patients to the clinic, it will generate the email and text message that contains the specific one-time use registration link. And that's pretty cool. It makes it easier. And I apologize for not having this work out exactly how you do it step by step, but I can also revisit it again at the end if my presentation will allow for that. So, okay, so since I am in PrepMod, I just wanted to let you know that if you're in PrepMod and also in the production site, you can access training materials. And so we have some guides here. A note for if you want to download this user manual, it's pretty big, so it might take a few minutes to get that taken care of. But what I really wanted to sort of highlight too was that we get a lot of questions on like what the user access level is. So if we've made you a venue admin, these are the things that you have access to that are yes. And then for lead staff here, and then for staff. Okay. We also wanted to mention that having enough admin staff to successfully hold your clinic and capture the vaccination data is important. And I will have April transition us back to the PowerPoint presentation. Okay. So I apologize. This does have a little bit of a capture of what I just showed you. When you are saving your file, you just definitely have to save it in that format of the CV8 dash whatever. I'm sorry, I can't see it. That's so tiny. And then also, like, here's the sample of the file that you would need to, the format that you would need to save that file in. And then down here, again, you know, making sure that you save it in the CSV UTF-8 format. And then next slide. Oh, that was what we just did. Okay. And then that's the user access level as well. Next slide. Are there any questions in chat? And if there are, I can definitely redo this portion of the training because it's really important. It's a really cool feature to show. So if there's those that either want to hang back or I could actually do another demonstration for somebody that's actually wanting to do this, I can do that with them personally.
I'm not seeing any questions in the chat, Jenny.
Okay, thank you, April.
You're welcome.
Next slide. Okay. And these are things that we want like you to keep in mind when you're in the during the a clinic.
All right, so during a clinic, there are a few things to keep in mind. I will be doing a demonstration in the PrepMod test site here in just a moment, but I did want to talk about a couple things first. The first thing being to have your users set up with a PrepMod account, so all the staff that will be working at the clinic prior to the clinic. It can be really hectic to try to get user accounts set up the morning of because of email and phone verification. So just having that set up ahead of time, it'll save a lot the morning of. And the next thing would be to have the paper registrations printed. This can save you some time, also some hassle if someone comes in on the wrong day or you have patients who show up last minute and they aren't registered at all, those can be great. So the paper registrations, if you do have someone who shows up on the wrong clinic day, so maybe they registered for tomorrow, the 28th, but they showed up today on the 27th, what you would have them do would be to fill out a paper registration and then add them into PrepMod yourself by clicking Add New Patient, and I will show that in just a minute. Once you have added them into the system for the 27th, you can go into the next day and just delete their original registration, and that way they won't be in the system twice. And then we have that appointment open up for somebody else who might be interested. And then if you have someone who shows up with no registration at all, they haven't registered for any clinic, but they were interested in getting vaccinated, then you would have them fill out that paper registration, and then you can just add them in. You don't need to do anything else. The paper registration forms are exactly like how they are online. So when someone registers online, it's basically just a printed form of that. And if you are able to have patients register online in the PrepMod site right then and there, that is also an option. But those paper registration forms can save some hassle because clinic days can get pretty hectic. So I am actually going to take over the screen again, and we are going to go into the PrepMod testing environment. So I will be using Jenny's test site account as well. So what you would do is click on clinics. Generally, you'll be looking for the county that a clinic is in, but for today, we are just using her name. And this is for when we are logging a vaccination. So when a patient comes in, they're getting vaccinated, this is what we would do. We would find the clinic and go to registration list. And it is an important side note to mention that there are generally a lot of clinics within, as of now, there are a lot of clinics on the same day in the same county. So to just double check that you're selecting the correct one. Once you are on the registration list, you're actually going to click on activity form over here. And this is where you will stay for the day if you are just entering vaccinations. So usually there will be a lot longer of a list because there are, possibly hundreds of people signed up. So it's much easier to find someone if we search for their name up here. And you may find them by first name and last name combined. If they have a really common first name, it might be best to just put in their last name or first name if it's the opposite. So once you have your patient, their name will be bolded if they said yes to one of the questionnaire questions. So if they said yes to having a chronic condition, to having a vaccine in the last 14 days, their name will be bolded. If they said no to everything, it will just be in the regular non-bolded font. So either way, just for verification, if you hover over this question mark, their questionnaire will actually pop up. So you can see what they answered yes to. If you just want to verify for the nurse or vaccinator that they said no to everything, then you can just double check in here. And it will also bold if they said, I don't know to something. So we see that a lot with if they don't know their reactions to COVID vaccine because it's their first one. So just to double check, you can hover over there. And then once we are entering their vaccination, we will click on the vaccinated bubble. If there's more than one lot number for the day, you will be able to scroll up and down to find the other one, but we just have one for today. We want to make sure that we select the correct injection site, the date, and then this is Pfizer, so it's going to be 0.3. And then down here, we would just select the vaccinator's name, the vaccinator nurse. If this is their second vaccine, we would click yes. So they completed the COVID vaccination series. And if it's their first one, then we would leave it as no. And then we would select update. And once we do that, their vaccinated bubble will be blue. So it will remain like this after they have been vaccinated. And then, like I said earlier, if you do have patients come in kind of last minute and you have to have them fill out the paper registration form, you can just go here to add more patients. You will select an appointment time for them. And then you will just copy down their entire, it's kind of a packet, it's a couple pages of this questionnaire. So you can just put down everything that they said in here and they will be good to go. They will be registered. All right, and so April, I'm going to turn the PowerPoint over to you.
Okay. After the clinic, this next section will be discussing what can happen after the clinic. So if you go to the next slide, these are things to remember when closing a clinic. You want to make sure that you're logged into production. The pink banner shows up on the test site, so that way you'll know that you're actually in production. Select Manage Clinics and Users. You will locate the clinic. Next slide, please. And then select Clinic Activity. And then select Activity Form. Yeah, that's fine. You can go to the next slide. Thank you. The Save and Submit button is on this activity form here. This is the very important last step to completing your clinic. Be sure to make any edits before you click Save and Submit. Once you save and submit, it triggers an email that's sent to the vaccinated patient with a link to their vaccination record. But most importantly, the patient's vaccination record will be sent to the Washington State Immunization Information System. Next slide.
All right, so these last couple slides are going to go over some data transmission errors that can occur. This first one is for some PrepMod errors and warnings, and this is on our end of things. So these are things that we might reach out to you about. We do receive a report each morning with some possible errors and warnings from the previous day. So if you do hear from us, it will more than likely be one of these for reasons. So the first one would be the expiration date. So when expiration dates do not match IIS and PrepMod, like I was showing earlier in the IIS dates really match up, it will send over. So if they don't match, or if that 2069 date is left, it can also populate like a warning. So just making sure that those match up and are correct in both the IIS and PrepMod. Number two is special characters error, and this is something like if a special character was added into someone's name when they were registering. These can cause an error when data is transmitted from PrepMod back into the IIS. So just ensuring that there aren't any special characters in patients' names. The third thing that you might hear from us about would be a warning that we receive about lot numbers. So if an inactive lot is used in PrepMod, it can cause a data transfer warning when transferring back into the IIS. And it can also cause some decrementing issues. So decrementing issues, how we would define that would be just that the data does not match up. So it can cause some data transmission errors or issues as well. And again, the reconciliation screen only houses active lot numbers. So if you do choose a lot number off of there, it will be active. But by chance, if an inactive one is chosen, it will populate a warning on our end, and we will probably reach out to you about it. And then the last warning is about the race and ethnicity question. So this is on the patient's demographic questions in the registrations. We just want to make sure that the question is being asked. It is not required, but we are making sure that folks are getting asked about that because it is good for data with the vaccine. All right, next slide, please. And then some decrementing issues on the IIS side. They are very similar, so I won't spend too much time on this slide, but lot numbers, again, making sure that those lot numbers match exactly in the IIS and PrEP mod. Even if one little character is off, it can cause a data transfer issue. And we have run into several times recently where if there are multiple lots used in a PrEP mod clinic, the wrong one is selected for several patients, and that can be easily fixed in the IIS. You will just search the patient and look at their vaccination date. And if you click on that, you can edit it. So you should be able to switch up those lots if the incorrect one was used. If there's not enough inventory, this can cause a decrementing issue on our end. Vaccinations won't decrement over. So just making sure that the quantity of the lot that you wish to use has enough. And if not, you are selecting another lot or you are adding multiple lots for a clinic day. Like I talked about earlier, you can add multiple. And then you're receiving those extra orders or transfers, looking on the advertisement screen if you need some extras. So those are all great resources. And then the last decrementing issue that we run into sometimes is if an order is received too late. So like I showed how to receive an order or transfer properly, even if those are received an hour or two after after a vaccination is administered, it will show up as, it will not decrement properly because it was administered before it was actually received in the IIS. So we do want to make sure that those steps of receiving orders and transfers are taken before lots are added to PrEP mod. And then again, that the expiration dates match exactly in PrEP mod and the IIS. You can edit those dates through the search and add lot numbers like I showed in the demonstration. All right, next slide, please. All right, and then were there any final questions? Anything else to go over in the chat?
I was chatting with Joanne. She had a really good question about special characters. And basically, any special character in a name or an address in the patient registration will cause a data transfer error. So if you see those in your patient registrations, you can edit them beforehand and prevent those errors from happening. Otherwise, if it does happen, it does show up on our report, and we can usually do some research and get that corrected. As far as other questions go, nothing at this time. No.
Okay. We're really interested in knowing what your feedback is as we move forward for future trainings. And we want to present topics, areas that you would like us, or you would like to know more about, or even better understand, so that we can best support your efforts in creating successful PrEP mod vaccination clinics. We also do have an Opinio survey that we can put in the chat or email to you. Next slide, sorry. And we're just really wanting to know, the areas that you would like to see us include for future trainings. and that a PINEO survey would be perfect for us to understand and know how we did. This is our first time doing this, and if you'd like to continue doing these types of clinics, or not clinics, I'm sorry, these types of trainings, so that we can best support you. Okay, so the next slide, we have our resources. This is our IIS training inbox. If you have questions about the IIS, you can send it there. And then for prep mod questions, like I said, we do man this box 7 days a week. And I think we even do have somebody that's going to be watching it on Memorial Day. So just letting you know that we're available. And then we have the resource pages for both the IIS and also prep mod. Next slide. So I just wanted to acknowledge the teams that are involved in these areas that we covered today. Our IIS section supervisor is Jeff Charis, and our prep mod team lead is Scott Carlson. And the folks that are on the prep mod team are myself, Brian, Mary Nell, April, Shayna, and Sanjita.
All right, and then on the IIS data team, we have Patrick, Deborah C., Bridget, Robert, myself, Marisa, Deborah S., and Bava. All right.
Okay. Thank you so much for attending today's training. If you've learned something new or understand a process better, I would consider this training a success. So we're open to questions if you have. If you want to either unmute yourself and talk, or if you want to put questions in the chat, we'll have those monitored. I think for those that have tomorrow off, today's your Friday, yay. We're actually here because in the spirit of like all of the efforts and everyone else that's involved in COVID, it's because we want to help. So this is for you. If you would like to give us more ideas on what we can do moving forward, that would be great. Thank you so much. Okay, nobody wants to talk. All right.
Thank you, Jenny and April, for such a nice presentation. We appreciate it a lot.
Thank you, Sanjita, for that. We really appreciate your support.
Thank you.
April, do we have this recorded?
We do.
All right. So then I guess if there's no other questions from folks, I guess we can wrap it up. Thank you, everyone.
Thanks. Great presentation.
Thank you, Jenny. And Marisa.
Yeah, thank you, everyone.